Jeremy's case was a pretty complicated, unusual case, especially for our facility.
He already was a complicated guy coming in the door because he already had his entire colon removed with cancer at a young age. I think he has the record as far as length of stay in the hospital.
We hit roadblock after roadblock, over 150 referrals out, all denied.
Serious end-of-life conversations with his family. You have to be prepared for the end. He came in for abdominal pain. Imaging didn't give us a clear answer of why he had pain, but then later that day, he all of a sudden started getting really sick, like blood pressure really low, so we rushed him to surgery. He had ingested a foreign body. He actually had ingested a piece of bone, and that piece of bone had actually perforated his bowel. It actually caused a really, really bad infection, a necrotizing infection. So I was just at the bedside while he was in the unit, intubated, sedated. I was debriding, which means cutting away that dead, unhealthy tissue. He actually left the hospital for, I think it was about 48 hours, and then he came back, and that's when he came back with a fistula. We have GI contents leaking into the wounds and onto the skin. And then the main treatment, or one of the main treatments for a fistula is just to time, and slow down GI function, which means we can't feed them. So basically from May till now, which is November, it was wound care and nutrition support.
TPN is very pricey and requires nursing. So not all facilities are capable of having the nursing staff or being able to do it because of reimbursement from insurance. So we kind of had to go back to the drawing board, which was meeting with Jeremy to figure out what his goal was. His goal was to get home. So we had to make sure he had all the tools in place to make sure when he went home he was successful so he didn't bounce back into the hospital.
They were actually able to take off the wean off the TPN for a duration. So we were all, cheering for him, and he was on board with heading somewhere. He's very receptive to the process.
So the first time I met Jeremy, you could only really get one-word answers out of him. He was super reserved, and so it's really been cool to see over the last 11 months how slowly we've chipped away at that, and he's really opened himself up to us, and I think let us see his heart.
Usually on the med-surg unit we see patients for 1 to 2 days. That's the max length of stay we usually have, and we've never had a patient like Jeremy that was here since January, and it's kind of awesome to see how he has grown from when I first saw him in January. He wasn't talking to any of us, always just in his own world, and now we're all best friends with him and love seeing him every day.
So on a day-to-day basis, I just would, even if he wasn't my patient, I'd go in and say hi to him and see how he's doing, because it was so interesting to me, just his story, and I just wanted to get to know that better. So that's kind of why I started, just popping in whenever I could and getting to know him.
Going home after 9 months, I'm excited, but I'm also scared, nervous, because it'll be the first time in 9 months that I'll be on my own. At the beginning, I wanted to give up, but here I am today, a lot stronger than I ever was. It took that 9 months for me to realize that I am strong.
It just shows how important it is to actually get to know the patients and care for them like I do for all of my other patients. Just adding that care aspect in just helps them overall, their overall stay. He is so much happier due to it, and all of our other patients can benefit from just getting to actually know the patient besides their medical needs.
There was times that I would just cry because I was so confused of, why did this happen to me? Loneliness. The nurses helped a lot. They talked me through it. But I just talked myself through a lot of it too when they weren't available. But I still, have some emotional, probably will for a while, just because I have missed out on 9 months of my life. So I keep saying I want to go home. Well, guess what? I'm going home, but I'll miss this place, honestly.
It was stressful, but also fulfilling at the end to see him be able to go home.
Ultimately, the fistula is healed. All he had left was two fairly small wounds on the side of his abdomen. I was just grateful that he was alive.
The odds have been stacked against him, and there's a little bit of hope, and then the hope gets taken away. And so to finally get here now, I mean, this is what we've all been praying for and rooting for. I think we've grown to feel like a little bit protective of him, and so to let him go out on his own, we're all trying to think of ways we can keep him just a little bit longer, but we're gonna get past that because he's got a whole life outside of here and a family outside of here. You know, he's been here for the birth of a grandson and family reunions and all those things that we all take for granted, that we get to enjoy in our ordinary lives, and he deserves to be out there doing all that.
I feel pretty good. I'm tired still a little bit, probably will be for a while, but you know, still learning to walk better, but I'm getting stronger every day.
Oh, yeah.
Okay, and 1,